I'm here with Eric Miller. He's the owner, president of CareMinders Home Care, headquartered in Bricktown, New Jersey. Good morning, Eric. How you doing?
I'm doing great. How are you?
Could you tell us a little bit about how you got involved in home health care? Maybe some special training that you have, anything background that you'd
Sure.
like to share with us?
Sure. Well, the main reason I got involved in home health care was because my grandmother had a home health aide that cared for her for the last several years of her life, and it was her name was Norma, and I remember my experience with my grandmother in the last few years of her life always included this caregiver Norma, and whenever I would go to see my grandmother, Norma would either be there or she would be coming back or running to the store. So I had a very fond memory, of that experience with my grandmother. So that's what pointed me in the direction of home health care. In terms of training, I'm a certified senior advisor. I have been certified by the Society of Senior Advisors to be knowledgeable about things that seniors are important to seniors in terms of their health and their welfare. And I've also been trained at CareMinders in the program that we have for caring for seniors.
Now, there are a lot of franchises out there to pick from in terms of home health care. Why did you choose CareMinders?
Well, I did a lot of research before I picked CareMinders. Initially, one of the things that kind of led me to CareMinders was I decided that I wanted to be able to do medical and non-medical home health care, and CareMinders program includes both medical and non-medical home care. Another reason was that in my research, I know that CareMinders offers the capability to be Joint Commission accredited in home care, which is the highest standard of in health care of outside accreditation that you could achieve. So that was important to me. I felt that that meant that they had a quality program that would be available to us to implement. And I like the people. I met the people. There's an excellent home care background among the folks in Atlanta where our company is headquartered. And so those three things really are what led me to decide to go with CareMinders Home Care.
And what kind of services does CareMinders offer?
Well, we start at the basics with companion care, and that is housekeeping, light housekeeping, running errands, perhaps taking a client to a doctor appointment, cooking meals, meal prep, and things of that nature. And then I like to say after that we cross over into personal care. And the difference between companion care and personal care is that once we cross into personal care, we're now able to do hands-on care. Companion care is no hands-on, personal care is hands-on. So now we can do all the things that companion care does in terms of housekeeping, errands, and etc. But we are now able to help people with bathing, various activities of daily living, bathing, grooming, dressing, ambulation, transfers. So that's the difference between the two. You have to have a license in order to do personal care from the New Jersey Board of Nursing. The next type of care that we provide after that is skilled nursing, and that might be wound care. It may be some kind of diabetic help. We also can do medication management with a nurse. And we also do offer the therapy. So we could do physical therapy, occupational therapy, speech therapy, all of this in the home.
Now, what area do you cover as far as regions?
We provide care in Monmouth, Ocean, and Middlesex counties. Our headquarters is here in Brick, where we are today, and we also have an office in East Brunswick.
When someone contracts for work, can they contract for the day, for the month? How do they normally go about that?
Well, it's really very flexible. That's one of the great things about home health care. We could do a day, although I'm not sure how practical that is. But yes, you could do anything from a day for a few hours, all the way through to 24/7 live-in care. And it can be anywhere from a short period of maybe even, as small as a week or two. And then we have, clients that, would require care for years. And so we do all of that from very, very short period, short time frame cases through to long-term, full-time cases, 24/7.
When it comes to hiring people, do you have any specific requirements that they must go through?
Yeah, we are what I like to say, we're a by-the-book agency, and we are very, very fussy about the caregivers that we hire. Anybody that comes to us has to come in and fill out an application. We meet them, we interview them. They go through an interview with our director of nursing, and we do a competency test, a written test, as well as a return demonstration with our nurse. We do an industry-exclusive 12-point background check on every employee that applies for a position with our company. And we do an initial at-hire and random drug testing of our employees throughout the year.
Now, as far as the state of New Jersey goes, what are you required to have in terms of certifications or license?
Okay, in New Jersey, you are required to have a license from the New Jersey Board of Nursing, which is part of the Division of Consumer Affairs. The name of the license is a healthcare service firm. They require you to be insured and bonded, and the license is good for the entire state, and it's provided by the Board of Nursing.
Now, if I were looking for home health care, why would I choose CareMinders over another company?
Well, there's a number of different reasons why. I think that first of all, the most important reason is that we provide the highest quality home care available. And the reason I can say that is because as I had mentioned earlier, we are accredited by the Joint Commission. Now, what that means to the person receiving the care is that we've been surveyed, we've been audited, we've been accredited by an outside agency outside of our company that has verified that the quality of care that we provide is at the highest possible level. In the healthcare industry, Joint Commission is the highest accreditation that you can receive. We take a case management approach to our home care, to our cases. So we're very, very thorough. We do an assessment at the beginning of every case. That's done by our RN, our Director of Nursing. And we look at the entire patient. We look at the home environment that they're in. We look at the health issues that the client has. And we look at different aspects of care that we would need to implement in order to keep people safe. And that's the big issue with us. We focus primarily on what do we need to do to take care of people in their homes so that they can be safe.
How can people get in touch with you, and do you have a website?
Yes, we have a website. The website is www.careminders.com. We have a phone number that is 732-262-1900, and that phone is answered 24 hours a day, 7 days a week. We do not have any answering service. We don't have any voicemail. That phone is answered by either myself or my wife, who is also an owner of the company, our Director of Nursing, or our administrator. So you will be able to get 24 hours a day, 7 days a week, you'll be able to get somebody on the phone that can address any issue that might arise with our company in home care.
Well, thank you very much, Eric. And again, would you like to mention your website? I'm sure that has further information if our viewers want to go and get some more details.
Yes, the website's www.careminders.com.
Thank you.
Thank you.